edbernstein.com.
Now, here's Ed Bernstein.
Hi, welcome to our show. My guest today is Mason Van Houweling, who is the CEO of UMC, and we're going to talk healthcare in Southern Nevada. You know, because, look, for years, let's be frank, for years in this town, when you would ask people, hey, where's the best healthcare in Las Vegas, they would say, go to the airport, right? That's really changed, and it's kind of changing under the radar as we speak. What is going on at UMC that's becoming so cutting edge?
Well, thanks, Ed. I appreciate the invitation and to talk to you and your viewers. Yeah, things are very exciting at UMC and what's happening in particular at what I call the hometown hospital here for Southern Nevada. We've been serving the community since 1931 and now are become the most advanced hospital in the state of Nevada. So we've got a lot of exciting things going on. Obviously, some of our services are level 1 trauma center. That's the only one in the state.
What does that mean exactly?
Sure. It is the highest level of traumatic care. It's at the peak and the pinnacle of acute care. We have about 17 different doctors on standby or within 30 minutes to be able to take care of the most traumatic injuries, not only in our community but also our state. And we pull from a 10,000 square mile radius, California, Utah, all over Nevada. And so we've got the trauma center, obviously.
And there's a rigorous certification for that, right?
There is. Every few years we go through, the American College of Surgeons comes in and looks at our policies and our outcomes, and I'm very proud of UMC. We have a 97% survival rate, and some of those patients had a less than 1% chance of surviving. So it is a very rigorous program, and again, we're the only one in the entire state. But we also have a big community outreach group that goes out and tries to reduce violence, reduce accidents, and do community education on things like Stop the Bleed, CPR, those type of things that are responsible for our trauma center.
Look, you brought up CPR, so we got to talk about your story.
Oh, sure.
because I know that September last year, was it last year?
It was last year, yes.
September last year, you're with your wife at the Golden Nugget Hotel, right?
Yes.
You're celebrating an anniversary.
Yeah. My wife wanted to get out and have some dinner, and I was a little reluctant that evening just because dealing with the pandemic and was very tired, but she insisted us going out. And certainly I'm glad I did, and met a gentleman, Pablo, who was in full cardiac arrest, and unfortunately he was on his anniversary from Phoenix and was at the Golden Nugget, and unfortunately had his cardiac arrest right on the casino floor. So fortunately, through some of my military training and healthcare training, I was able to perform CPR, and Golden Nugget staff did a great job and had all the right equipment. AEDs are extremely important, Ed, and that certainly saved his life, and ended up having bypass surgery at UMC, and was able to send him back to Phoenix, and he and I continue to stay in touch today.
Yeah, and you're really underplaying your role in it. But yes, I mean, you saved his life, basically.
Yeah.
Without your delivering your CPR, the equipment they brought in subsequently would have been useless, right? Yeah. Well, by the way, when you're doing the CPR now, it's just chest compressions, right? You don't do the mouth-to-mouth anymore.
Correct. They, did not have to perform mouth-to-mouth did the CPR on Pablo. And then again, it's just a rhythm. Staying alive. Everybody knows that song. That's usually what you go to, but you need to get deep compressions in. But certainly AED, he did not have a pulse. So that AED analyzed, we were able to put the AED on him, analyze him. It shocked him. We continued CPR, and then he opened his eyes, and I knew that we had him back, and Clark County Fire picked him up, and the rest is history. So yeah, it's certainly life-changing for me in that moment and that evening. Never forget it.
Yeah, and I had read that they revived him, and you want to put him in an ambulance, and you don't want to go in the ambulance, although he needed open heart surgery right away.
Yeah, he was a little confused and felt like he had just tripped or fell, and wanted to get off the stretcher. And I said, Pablo, you need to go to the hospital. We're going to take care of you.
So this is one of the things that UMC offers to the community?
Yeah, we have a great Healthy Living Institute. If you go to UMC's homepage on our internet, we have a Healthy Living Institute that does a lot of community outreach. It's wonderful. I'd love to have you come over and take a look. We do everything from installing cart seats for the community, the Daddy Boot Camp, to exercise classes for seniors to prevent falls, but also CPR. And I'll tell you, you've got CPR and stop the bleed training, you're a pretty powerful first responder.
Right. That's important.
Yeah.
Right. So here's a living example of why you need to get to the CPR classes.
That's right.
Most of us don't realize how large UMC is. You have, what, over 4,000 employees there?
Yeah, we're a pretty large hospital, 541 licensed beds. We have some very high-end services, trauma center. We are a transplant center, a verified burn center, and the only accredited children's hospital. But it takes a lot to run that institution. But we also have a very robust ambulatory network out in the community that we take the UMC brand and deliver medical care to those areas that perhaps don't have access. So primary care, which is your doctor you see on your routine visits, and then our urgent care model, our quick cares are for those aches, pains, and bumps and bruises. And we're continuing to grow that. We're going to be in Aliante later on this year. We added a clinic at the airport recently. We're expanding in Southern Highlands, and we're going back out into Laughlin too to deliver health care and out in Clark County.
And is that a busy clinic over at the airport?
It is very steady. One of the things that when we opened it, especially because we're providing COVID testing there as well, we have providers there, but the COVID testing demand was very high at that point. But we do have a steady volume, and it's from 8 to 8, 7 days a week. So we're seeing both local work comp cases that happen out at the airport. So we're seeing a lot of things that for the staff that work out there, both at LAS, but also some of the vendors, but also your traveler that's not feeling so well. We're able to get them taken care of and get them medications as well.
You have a lot of dehydration cases from flying there?
We see all kinds of things. Mostly people just feeling a little under the weather, and but we also have X-ray technology out there, so we're able to perform X-rays, whether it's chest X-rays or other parts of the extremity, and that helps us deliver a bit more care there.
UMC has always been known in a very positive light for the burn center that they have there, right? And that is a partnership with, what is it?
The Lions Club.
Yeah.
And it's the only one in the nation, and we're very proud of that relationship. And it's been long-standing. And they deliver great care, and some of the things that we're doing there in advancements in technology has been pretty remarkable as well. But yeah, we love the relationship with the Lions Burn Center, and we save a lot of lives.
And we have, is that the laser that they're showing?
Yeah, that's actually, that's unique and first and only in the state. We're able to do laser therapy for scars and helping patients recover a little bit quicker. Better pain management, but also reduce that scarring that typically goes with burns. But really have some great technology there. And that's Dr. Sakib, a wonderful medical director. He's with UNLV Medicine, but we have a great partnership with him. And the staff do amazing work there every single day. We have inpatient, but also outpatients that we take care of.
I was being kind of joking when I opened the show about healthcare in Las Vegas prior to UMC being where it is today. But one of the other complaints I've always heard is that we didn't really have a medical school for the longest time. And then when we got one, it seems like a lot of the residents maybe left Las Vegas and went to hospitals outside of Las Vegas. And doctors and residents tend to end up working where they do their residency. And we were losing a lot of qualified doctors to that. That seems to be changing.
You've got it exactly right, Ed. I mean, having a medical school here in Southern Nevada with UNLV, in fact, they've got their first class in their 4th year. Still relatively new, but they're clipping along beautifully. And we've always had the residents at UMC. We've got 215 residents in 17 different programs at UMC. So our partnership with UNLV and UMC is vitally critical to be able to keep those doctors in the state of Nevada. The pandemic has shown that we are woefully short of across the healthcare spectrum with healthcare workers. So we need more resident slots, we need more faculty teaching, and we'll be able to keep those healthcare workers. And as you know, the state is growing exponentially right now.
Right, but creating that residency program at the hospital is really key of getting us the proper staffing and doctors and nurses that we do need.
Yeah, and I think the residents, if they have a good experience at the hospital that they're working at, often stay. And so that's our goal. Is we've seen that we've got a medical school, we've got residents, and then there also is fellowships at a little bit more advanced training, which we also have at UMC. They're very highly likely to stay in the community. So that's our goal, and seems to be working so far.
You served for a number of years in the the reserve?
Air Force
Reserves. You're
yes.
lieutenant, ended up being a lieutenant colonel.
Yes, sir. Yep.
And you dealt with healthcare there on the battlefield in Afghanistan. And you've been doing it. I don't know how long you've been doing it. 25, 30 years.
25 years of service. I retired last year, and but yeah, I was trained as a healthcare administrator in a medical service corps, and was often deployed with the Army. So. Even though I was at the Air Force, often deployed with the Army, doing a lot of their air evac missions and kind of war planning type of things, but served in Afghanistan very early on, and definitely learned a lot. And a lot of the innovations that come in healthcare today, even at UMC, are often discovered and expedited on the battlefield because of some of the first responding and things that we do in the trauma center. And one of the programs I'm very proud of at UMC is we have what's called a SMART program. It's Sustained Medical Readiness Training for the Air Force. And so we, every day I have about 60 medical medics, Air Force medics at UMC across all different types of specialties, working side by side with our UMC doctors and nurses to be able to provide care. So it's a learning lesson for them. They're able to see some of the things that they would see on the front lines. But we also, it's very reciprocal that we learn a lot from them on some of the advancements in medical care. So again, it's a marquee program for us, and very proud of our relationship with Nellis Air Force Base.
Yeah, it seems like a wonderful program, and there's very few of them in the nation. Right?
We're only we have 3 in the nation, and we think we're the best at UMC and with Nellis Air Force Base. But we have a lot of the generals come through, and we've had assistant secretaries of defense come and look at the program, and they want to continue to have that military-civilian partnership throughout the nation. So we get a lot of visitors seeing how we're able to make it at UMC.
Right. Because you get, like at UMC, you'll get some gunshot wounds, you'll get some, injuries that are similar to what you see on the battlefield, burns, that type of thing. And so the education flowing both ways, and the experience flowing both ways is incredible value. Yeah. Have you always wanted to be in the medical profession? I mean,
yeah, I think I had some influence from my family. I had an uncle that was in the medical field, more in the hospital administration. So certainly, once I found my calling, I just really committed to the field. So I take great pride. I'm not directly at the bedside, but I'm able to support those at the bedside, get them the tools they need, remove the barriers, and just provide the best outcomes for our patients. So I take a lot of pride in that.
Look, being a CEO of a hospital as large as UMC, it's like being a mayor of a city.
It is. It is. If you come into UMC, it is a city within itself. Like you said, we have over 4,000 individuals that take to run UMC's enterprise, and it's a very busy place, but very warm and inviting, and morale is great with the team there. So we've got a wonderful team that's worked tirelessly through this pandemic and kept their heads up and done a great job, and they are true heroes back at UMC.
Yeah. Well, let's talk about the important things. What can we do about the food at the hospital?
Well, hey, I'm going to invite you over. In fact, that's one of the things that the patients rate as well. I actually stole a chef from the Wynn, so we've got great hospitality and great food here in our community. So that's not an issue at the hospital anymore. Those days are long gone.
Yeah, you go to a hospital hopefully you're going to eat healthy, right?
Yes, yeah, we've got a lot of healthy options too.
Let's talk about some of the other new equipment, surgical equipment that you have here. You have, robotic knee replacement. What is it? It's ROSA.
The ROSA.
ROSA.
Yeah.
Stands for something, I'm sure.
Yeah, and what's unique about ROSA is it takes images and puts them in X-ray images and puts them in a 3D model to be able to help the orthopedic surgeon really customize that knee replacement for the patient to have the best outcomes and make sure that we're implanting the right device to be able to have that quality of life that we all want. So that's one little technology that we have at UMC that really is differentiating us in our technology, and it's really helped with patients and getting them back on their feet.
Now, when you decide to bring in a piece of equipment like this, I always guess that it's very expensive, this equipment, right?
It is. Technology is very expensive, and it changes very rapidly. When I entered the field, you would get an MRI or a CT that would last you 10, 15, 20 years. A lot of this is changing 3 years, 2 years. So it is very expensive, and it changes very rapidly, but we're committed to staying on top of that just because we think it's the right thing to do for our patients.
So when we look at the cost of medical care, is that a major component in the increase costs, some of the equipment, or are there other causes?
It's healthcare costs certainly are on the top of mind of many states and the federal government, and it's a big component of even our own state's budget. And we're always trying to drive down the healthcare costs. So as new technology is introduced, things are a little bit more expensive, but other things are the price is going down on other areas. I think certainly with the pandemic, the supply costs really got out of control of some of the things that, because of the supply chain issues that we had throughout the world. But certainly that's not passed on to the patient. A lot of those rates are already negotiated. We're just trying to minimize time being in the hospital, having better outcomes, getting people back on their feet, reducing infection rates is a big thing, reducing blood loss, minimizing scarring. Our Da Vinci robot that we have is a pretty robust piece of equipment. That was really the first piece of equipment that got us started in technology, where you're able to do GYN surgeries, urology, general surgery, and then also we've got a surgeon that is going to start embracing that for thoracic surgery too. So, but that piece of equipment's well over $1 million, but we think it's a great investment because of the benefits it has for our patients.
Yeah, it's like the Cadillac of the minimally invasive surgeries, right?
It is. It's got a lot of use, and it will continue to evolve.
Robotic assisted platform for minimally invasive lung biopsy.
Yes, yeah.
Right, this is just, how was it done in the past? Let's start there.
So this is, this was really antiquated technology that we had previously. So if somebody had a chest x-ray in the past and they saw a spot, a pulmonologist would see a spot. Unfortunately, we did not have technology to get to those smallest nodules in the lung. So what was called the watchful waiting period. So if you had an x-ray and your doctor saw a spot on your lungs, they say, hey Ed, we may be concerned about that, we may not, but what we'll do is we'll take an x-ray in 6 months. So on your mind, you're worried for the next 6 months. So what we have with Dr. Romero, who's a phenomenal fellowship-trained pulmonologist with UNLV and UMC, we're able to take that technology. It's almost like a GPS. It's able to go down to the smallest nodules of the lungs, be able to get that tissue sample, be able to remove it. It's got a 180 articulating scope to be able to 180 degrees to be able to take that sample, remove it from your lungs, and then we immediately take that to our lab. So by the end of the day, you'll know if you have a concern that may have some type of lung cancer, and then be able to start that planning process for treatment, or it's just something that we need to just continue to watch and not be concerned about. But the days of watchful waiting and taking an x-ray and kind of hoping and praying that it's not something are over, which is great.
That's an outpatient procedure?
It is. You can come in the morning and be done by noon and then get those results by the end of the day.
Just little hole or two, and that's it, right?
Yep, goes right down the pulmonary lungs, and you're able to. You're not even going. You're going through your throat and the mouth, and going down to the lungs, and being able to get that.
Wow.
Yeah, and it's all GPS technology.
Yeah. As we sit here, the first week of March, what's the status with COVID over at the hospital?
We're looking really good. As of this morning, we have 5 patients that are directly admitted for COVID.
Compared to?
Well, we were upwards at the Omicron peak, close to 200 patients in the hospital.
Wow.
So close to 1/3 of our patients directly admitted for, the numbers are looking really good. We're able to continue to diagnose and treat those patients. It seems like Omicron's running its course, its lifespan, so we continue to watch that, but we're in a good spot right now, and all the hospitals in the Valley are as well.
So is the hospital returned to normalcy? I mean, there was a period of time where you couldn't go visit somebody in the hospital. That was obviously a big problem for families and patients, but Has that changed?
It is. We've kind of gone through some ebbs and flows related to our visitor policy, some of the peaks where we saw positivity rates, 60%. The positivity rate now is minimally spread, so it's around 6% that we're seeing in the community right now as far as the testing that we're currently seeing. But testing's way down. But yeah, we had to make some alterations to our visitor policy, our elective surgeries. As you remember, we had to cancel all those just to be able to make sure that we're able to accommodate the volumes that we're seeing at some of our peak. But we definitely believe at UMC the family is a very important part of the care team. And so our visiting hours are back, our elective surgeries are back at 100% currently, and we'll continue to monitor that.
And what did you do to keep your employees safe? I mean, did you have a lot of employees out with COVID at that time?
We took a lot of steps from the beginning, Ed, whether it was protecting them with their PPE, and we were sourcing not only the state, the country, and the world. We were very quick and nimble to be able to provide the equipment that they needed to have in treating COVID patients, but also be able to protect themselves and their families when they went home. UMC is the only hospital that tested all their employees. We had that capacity very early on. Very proud of our vaccine rate that we had at the hospital, 98% of our staff. Very early on, before it was CMS mandated, they stepped up and were vaccinated, and then the rest were either through a medical or a religious accommodation if they met the qualifications. But we do a lot for our staff, providing the tools that they need to be able to be safe. We have a very safe environment, and every patient that came into our hospital was tested too. So if they weren't there directly for COVID, say if they sprained their ankle running or had a heart attack or a stroke, everybody was tested. We were able to identify patients that did not know that they were COVID positive.
When I drive by UMC, or every time I drive by, you see construction going on, building changes. Where do you see UMC in the next 2 to 3 years?
Well, we've got a very exciting project going on that we're going to be kind of beautifying, unifying the campus, doing a major facelift on the entire 26 acres at UMC. So that includes new sidewalks, new lighting, landscaping, new facade, all to really to reflect the great care that's happening at UMC. And so that's in the bid process right now, and we're looking forward to starting that project. But it's going to be really something special that the community could be proud of. And again, the campus is going to look beautiful over the next 2 years.
And of course, the city is a partner in all of this, and they're creating a medical zone, medical district in that area between Alta and Charleston, and between Rancho and Martin Luther King, I guess.
Yes.
Right? You have UNLV coming in, the medical school, going to send some resources over there, some classrooms and training facilities, as well as Valley Hospital also there, right?
Yeah, the city's done a great job of investing in that area, and it's a lot of economic impact in the medical district. So, the UNLV is kind of doubling down on the Shadow Lane campus. UMC's got its projects, and the city is really promoting medical investment in that medical district area. So they've done a great job.
I'm just looking through my notes because I don't want to miss any of this great new equipment that you have coming into UMC. Is there anything that we haven't discussed yet?
Ed, we've got spinal robots that really help the spine surgeons with precision. One of the things that also that we have is, and it's called ADOC, but it's artificial intelligence that sits on all of our radiology images, and we do a lot of images throughout the hospital, whether it's MRI, CTs, X-rays, but it's going to help diagnose and catch maybe pulmonary embolisms or masses on certain images to help assist the radiologists to better diagnose patients. So artificial intelligence is being implemented at UMC, and it will be the first in the state to be able to have what's called ADOC, and it's going to help better diagnose patients.
Wow. In the past, I guess you had to go to a radiology center to get some of this equipment. I mean, everything seemed to be so, you have to go to Steinberg or Quest to get this done, Steinberg to get this. I mean, is it the goal of the hospital to be self-inclusive when it comes to those kind of auxiliary services?
We certainly work with those partners that you mentioned. Desert Radiology is one that we're particularly partnered with at UMC, and they've done a great job of introducing technology But certainly where things, we're trying to drive things more to an outpatient setting, less invasive, less costly, better value, better access for the patient. But certainly there's going to be a need for acute care services such as UMC. So we're balancing that. That process as healthcare continues to evolve very quickly, and UMC is ready to be able to be in both those spaces, the outpatient and the inpatient space.
So on the outpatient side, you really see the future of UMC, and I guess most urban hospitals of having satellite quick cares.
Yeah, that's really our strategy when we look at where we want to be. We believe in the primary care market, the outpatient market. Obviously, the strength of UMC back at the main campus is always going to be there, but that's a delicate balance, and we're trying to make sure that we meet the needs of Southern Nevada here.
Is our biggest challenge still attracting physicians to come here?
You know, I think the workforce shortages across the board is a big issue, and the Governor Sisolak is very involved in this. In fact, I'm the chair of the Nevada Hospital Association, so I talked to him a lot about our workforce and some things that we can do at higher education to be able to increase those slots, increase faculty, because healthcare is a great field and it's got a great future. So we need to be able to expand that as our state grows.
Right. And what about the nursing industry? Are we still having a shortage of nurses?
We do. We continue to have nursing shortages. I think the pandemic really put more of a spotlight on that. And we continue to, unfortunately, have to recruit at other parts of the country where we would like to grow our own here in the state of Nevada. So I know the governor is particularly interested on how do we do that together with the healthcare industry.
Right, because we have several schools. We have
do.
UNLV, Toro,
Roseman, yeah.
Right.
And we have great schools. We just need to try to accept more candidates and expand those programs because we have the jobs ready for them.
Has COVID caused more or less people to enter the profession? You know,
unfortunately, we did see kind of an out-migration in some of our workforce, some of those, in particular nursing, that they're very tired, and we saw a little bit more of a exodus related to retention of those nurses. So we need to kind of rebuild that base and that workforce. But unfortunately, it did take a toll on not only in Nevada, but throughout the country. So we're having to bring in others, travelers and other contract staff to be able to make up for the shortfalls that we don't have throughout the state.
How did you find your military training helpful to be a CEO of a hospital?
Great question. I get that asked a lot. Leadership. Bottom line, they really put you in situations where you have to make decisions very quickly. People look to leadership, especially during these times of crisis, and it's really served me well. And so I think I'd do it all over again, Ed. It was the best thing I've done in my professional career, and they really teach you great leadership skills and being able to motivate and get people on board and communicate. So I recommend it to anybody that is thinking about it.
Oh, that's great. Look, this is a new UMC, so you're offering community to come out, and there's a tour available at UMC.
Absolutely.
Go out, check it out, talk to your doctor about some of the new technology that's available over there. And thank you so much, Mason Van Houweling, for your CPR skills. Yes. And for guiding our hospital into the future.
Thanks, Ed, and thanks for what you do for our community.
Thank you.
Appreciate it.